All right. Well, I'll go ahead and say a hello to everybody as folks continue to trickle into the Zoom webinar. Welcome to our event called Cuba, Chernobyl, and COVID-19, the post-film discussion of the film Un Traductor, Spanish for a translator, a Cuban-Canadian production directed by brother directors duo Rodrigo and Sebastián Barriuso, who are with us today. We're really happy to have all of you together with us in this webinar. This partnership between Heinrich-Böll-Stiftung and Beyond Nuclear and Goethe-Institut Washington has gone back quite a few years. Linda, I think, Linda and Nora, you probably know about the history of it a little more than me, but we've been doing this for a while around the time that usually is the anniversary of Chernobyl in April, but of course, given the things that have happened in 2020, we have tried to sort of calibrate ourselves and figure out how we can do a virtual screening and a post-film discussion online. And so we are really excited that we've been able to come together and make this happen today on this very hot, at least in Tacoma Park, Maryland, July day. So my name is Raleigh Joyner. I am the the cultural programming coordinator at the Goethe-Institut German Cultural Center in Washington, D.C. I'm broadcasting out of Maryland right now. And once again, thank you all for joining us. We hope that you enjoy our program and our conversation today. It is sort of a combination between a follow-up to the film Un Traductor, a translator, and also we're going to talk a little bit as well about the Cuban doctors who treated patients from Eastern Europe who were ill with radiation illnesses. And we're also going to talk a little bit about Cuba and those same doctors and what they're doing today in the time of COVID-19. And in our conversation, we have, in addition to Linda Pentz Gunter from Beyond Nuclear and Nora Löhle from the Heinrich-Böll-Stiftung, we have Kate Brown from MIT, we have Medea Benjamin, and we have Rodrigo and Sebastian, and Linda will say a little bit more about them when she does her introduction. As for myself, I will just go ahead and let you all know a little bit about what this webinar is going to look like in terms of how it can be interactive. So if you look at the top right of your screen where it says speaker view or gallery view, I would strongly recommend for this particular event to toggle it. It's on your end, something that you do, to toggle it over to gallery view. That way you see all 7 of us. We're sort of stacked like the Brady Bunch, Hollywood Squares, what have you. It's better to sort of see us that way since we're a bit of a larger group. So I would recommend that. And then, of course, because this is a Zoom webinar, we also have a chat box, which I'm seeing is very nicely flooding with wonderful comments and people already. And we also have the Q&A function. So just a little bit about that. The Q&A function, when we sort of finish the introductory comments and conversations questions, we're going to take Q&A from participants. And that is where I would ask that you direct your Q&A, where we can look at all of those questions. And regarding the chat, that's more for commenting sort of off the cuff things that are relevant to the topics that we're already talking about. Q&A is more for taking things in a new direction and posing questions for us to sort of transition to new topics and themes. And having said that, once again, thank you all so much. I'm just going to keep saying that because I keep seeing the attendee number come up. So thank you so much for joining us today. And I'm going to go ahead and hand this over to Nora Löhle, who is the Program Director for Energy and Environment at the Heinrich-Böll-Stiftung in Washington, D.C. So hand it over to Nora.
Thank you so much, Raleigh. And a warm welcome to everyone joining us at this webinar in very different time zones. I did see in the chat that we have people joining from different parts in Europe. I have seen Sweden on board. I have seen many different states, Washington State. We have DC joining, Pennsylvania. We have people from Vancouver in Canada, Toronto. So many different places, many different time zones. I'm very happy you can all join and stick around. It's going to be a fantastic discussion. My name is Nora. I work for the Heinrich-Böll Foundation, which is the German Green Political Foundation. So we are affiliated with the German Green Party, but are an independent think tank, and we mainly work with and support civil society organizations in their fight for climate change, or in their fight against climate change, I should say. Also important topics we work on are gender equity and democracy topics all over. And so the film Un Traductor, created by Rodrigo and Sebastian, who we will be talking later about, I think it's a fantastic movie and really struck us as an organization. First, it's really a fantastic artistical production, but at the same time, we really also saw the potential in this movie to offer an educational tool and a learning experience on a very underreported story, which is the Cuban health program, which has been done over years in helping and treat victims from Chernobyl. And I just want to say that coming from the whole green movement in Germany, which was pretty much started with the anti-nuclear movement in Germany when the nuclear accident in Chernobyl in 1986 happened, we saw the German society really like learning more and raising awareness of the big health risk of nuclear technology, and Germany at that time, and still is a country which is powered to some extent by nuclear energy. So it was of a huge concern to German society at that time, experiencing that nuclear accident. And that has really led into an anti-nuclear movement, which is still a very vibrant movement, and which actually led to the creation of the German Green Party later on. And that at the end, like lots of demonstrations and lots of calls out to end nuclear power in Germany led to then policymakers in Germany at the end to agree on a phase out of nuclear, which we are pretty close to finally face. In 2022, we are shutting down the last nuclear plant we have in Germany. And all the electricity which used to be powered by nuclear energy now is replaced by renewable energy, thanks to our huge incentive program, the energy transition towards renewables. So I think Germany has really like gained a lot of experience being a country being powered by nuclear power, and now doing a lot of effort to replace that and finally phase out of nuclear. So I'm very excited for the discussion later on.
Thanks, Nora.
Now to Linda, Beyond Nuclear, and Linda will introduce herself and then also our speakers and moderate our discussion.
And I will be co-moderating it with Nora and Raleigh as questions arise. So my name is Linda Pentz. I'm the international specialist at Beyond Nuclear, also based in Tacoma Park, Maryland, which happens to be one of the first nuclear-free cities ever in the United States. We're very proud of that. And we work, as our name suggests, to end the use of nuclear power and certainly also nuclear weapons as well. The first time I saw Un Traductor was on a tiny screen on the back of someone's seat on an international airlines flight a couple of years ago. And I was struck then about how beautiful it was and how moving it was, and felt very strongly that this film should be seen by much wider audiences, particularly our own movement, which I myself had no knowledge of this program. So I felt like it was really important to at least get it into the sightlines of our own movement. And so tonight is a culmination of that, but so much more, because we have such a breadth of different demographics in our audience. And that is indeed in a great part thanks to our co-partners tonight, Heinrich-Böll-Stiftung and Goethe-Institut, which, as Raleigh said, have been wonderful partners in the past, putting on commemorative events around either the Chernobyl or the Fukushima anniversaries. Also, we did a co-screening of Wackersdorf, which was about getting rid of reprocessing in Germany. So we've had a fruitful partnership, and without them, we could not have done this program tonight. So thanks again to both of them. I'm now going to introduce our speakers, who you've all already seen on screen, a little bit more about them. beginning with Sebastián and Rodrigo Barriuso, who have a lot in common. Obviously, as you know, they are brothers, and they are both from Cuba, and they are both also filmmakers, both as directors and producers. And I think that I'm correct in saying that Un Traductor was their first and possibly only collaboration as co-directors of a full-length feature film, but they are both involved in other projects, other film projects in their own right. Sebastián and Rodrigo won the Best Director Prize at the Shanghai Film Festival for Un Traductor, which also garnered the audience prizes in a number of countries, including India and Switzerland and Italy and Panama. So it's had popularity across a lot of different cultures and countries. And it was Cuba's official entry to the 2020 Academy Awards. Both brothers are based largely in either Toronto, Canada or Miami, Florida, but Rodrigo is joining us tonight from Paris, France. So we thank him for staying up a little late to join us, and we welcome both of you, Sebastián and Rodrigo.
Thank you so much.
Kate, you're welcome. Kate Brown is a historian and author of Manual for Survival, a Chernobyl Guide to the Future. If you've read this book, and I hope you have, and if you have not, I strongly recommend that you do, you'll know that it is breathtakingly thoroughly researched. I don't think there is a dusty archive left in the former Soviet Union that Kate has not burrowed into and extracted some extraordinary information. And it obviously helps greatly that she speaks Russian and Ukrainian, and has been able, in fact, been in many situations the first pair of Western eyes ever to read some of these documents. That has been extraordinarily important in informing her book. She also took the trouble to go back to the Soviet Union as it was, or as it was formerly known, where she worked when it was the Soviet Union, and interview countless people, from top officials down to farmers, to really uncover the true health consequences and the reasons why they've been suppressed of the 1986 Chernobyl nuclear accident. So welcome, Kate Brown.
Yeah.
Medea Benjamin is the co-founder of Code Pink, Women for Peace. And if you have ever watched any contentious news footage or read a newspaper article regarding events surrounding anti-war or justice, you've probably seen Medea being dragged from the room. She is an inveterate protester, but also the most committed person I think I know to the causes of peace and justice, and is willing to put her freedom at risk and her person at risk physically for those causes. And like Kate, has an intelligent curiosity that has led her to travel in person to some of the so-called more controversial countries like Iran and Cuba to find out the truth for herself. And we're very happy to welcome Medea Benjamin.
Nice to be with you.
So we'll get started now with the Q&A. As Raleigh mentioned, we're going to do a couple of rounds of questions with our guests. They may in fact ask each other questions as well. We want to keep this reasonably conversational as the technology allows. We can't nudge each other because we're all in different places, but we'll try to do that. Please put your questions into the chat function, into the Q&A function. The chat is for chat. The Q&A function is for the questions. If you have not seen the film, you still can. It is that link that you got in your Zoom registration is live until July 27th. So we'll get started. My first question, I think, is for you, Sebastian, but feel free to jump in, Rodrigo, as well. So when I was actually lucky enough to see this film again on the big screen at the National Gallery of Art in Washington, D.C. Sebastian and Rodrigo were there for the Q&A. And when the credits were rolling, there was a sort of an audible gasp. And if you've seen the film, it's no spoiler to say that the gasp was because they saw that this was a true story about your father. And so therefore a very personal story, something that actually had happened. And you've talked about this story being ordinary people doing extraordinary things. I wondered at what point, and you, Sebastian, were obviously alive during this period. I assume you're the small boy that we see in this film, the first son. that at what point did you both realize that this extraordinary thing that your father had been part of was the perfect material for a feature film?
Well, thank you again for having us here, to all the panelists and attendees. The story came as, at least in my experience, most good things happen in life. It's like when you are not expecting them at all, you just have like a moment of realization, and you understand all the potential that you have been having in front of your face all your life, right? And in this case, I was attending a film program in Toronto, Canada, which is where Rodrigo and I officially are based. And then as part of that program, we had to develop a film. And it was in the same, like, it was closer to the anniversary of Chernobyl as well. And it happened that I had to attend a party at, during that time. And there was a bunch of teenagers. They were like younger than me, and everyone was from an Eastern European country. And I had a flashback to when I was a kid, and I saw my dad repeating the same things, like, "Oh, I'm going to the hospital. I have to translate for these kids." And that idea like stayed with me for a few weeks. And across those weeks, I started to write, and I reached out to my dad and called him and was like, "Man, I think that we have a good story here. Like, if you have any memories from this period of time in your life, it would be amazing if you could write those down and send it to us so we can start building a concept, see like what is it that we can produce with it." And over the course of like a week and a half or something like that, I was on my way home pretty much at the same hour in the subway in Toronto. And there's a part of the subway that has allows reception for mobile, and I will receive the email from my dad at that same time every day. I would start reading it and start crying in the subway for a week. And after getting home, I will have all of those ideas in my head, like spinning around. And then we finally start working on it. And then I proposed the idea to Rodrigo, and then we start working from that. Do you want to add something to that? How do you remember the origins of the story, Robo?
I remember, well, your story is always very compelling to me because for those who've seen the film, I do not have lived memories of that period of time. I was very small when it all happened. So the stories that I know are stories that have been passed down to me. So it was very beautiful at the beginning to see your passion, Sebastian, about this story and about the project, but also to see how personal it was to ask our father to remember those stories again and to retell them to us, because it was such a raw, visceral period of his life. And for him to revisit those stories so many years later and to, you know, as we say, put pen to paper for us to be able to develop a script from them. For me, always the genesis of a project, that first conceptualizing of a project is the most beautiful stage, because that's when you're beginning to decide how it's going to happen.
And I think that, you know, you can feel that inspiration in the way the film is made. It's deeply moving. And I think that, Kate, my question to you is, you know, obviously the film shows the very beginning of this program, the first year or two. I think really the very beginning, and the move to Tarara. And yet this program went on for 21 years. And I think for a lot of people, it must be baffling as to why children would get sick for 21 more years. And in fact, we've learned that it's now resumed with the children of those children. In your book, you talk a lot about, you know, why people were affected through the food chain and other ways. I mean, can you address why children would need to keep coming and as victims of Chernobyl to Cuba for decades, even after the disaster occurred?
Yeah, I checked in my database that I have from my archival work in Ukraine and Belarus and Russia, and I saw that the first mention of kids going to Cuba was in 1990, Just the first one I have in my database, it might have been earlier, from a town, a Ukrainian city called Zhytomyr, and they said that the kids were going for, because they had hematological problems, and that some of them needed bone marrow transplants, which you show a number of kids getting what appears to be bone marrow transplants, especially that boy Alex, who's in isolation. And you show that so touchingly. But what I found, when I worked in the archives, I first went to the medical records, and I saw this incredible impact of what they eventually started calling a public health disaster, where especially kids and pregnant women were most vulnerable, and they just started to get hit low with all kinds of chronic illnesses and cancers too. The leukemias came right away, but some of the cancers came later. And so you'd have a district, a county that would have, before 1986, they would have they just, in the social system, they just kept these kind of records. They'd have 10% of the kids in this district have a chronic illness, maybe 20%, that would be a high number. By 1988, that has flipped. And so you have 80 to 90% of kids have some chronic disease or another. Many have multiple chronic illnesses, and 10 to 20% are healthy. So what you see are these really vulnerable kids. Kids are vulnerable because their cells multiply very quickly as they grow. They take in they're very efficient in taking in a lot of minerals in their foods. And so if those minerals are actually radioactive isotopes that are mimicking minerals that the body needs to function, kids soak them up very efficiently. And then those go right to these rapidly multiplying cells. So I then moved on to the Ministry of Agriculture records, and what I found there, I was like, so what, why are all these people sick, and what kind of doses are they getting, and where are they getting them from? So I went to the Ministry of Agriculture records, and there it showed that the Soviets were very good about monitoring levels of radioactivity in the food supply, and it was just a sort of complete, almost every food everybody ate had some levels of radioactivity. Some had really high levels, milk, meat, things that people took in on a daily level, especially were really high. Even like mother's milk was above permissible limits, in 21% of mothers. It's just crazy. So these kids, as they're born later after 1986, they're still taking in doses of radioactivity. And this is mostly radioactive cesium, radioactive strontium, some radioactive plutonium, after the big influx of radioactivity. So that would explain why kids born, say, 1990, 1996, in these areas would still have health problems. These are agricultural regions. People they farm, and they eat what they produce, and they eat what their neighbors produce. So it was a pretty shocking story. At some point they after the accident, they killed about 100,000 livestock, cows and sheep. And then they didn't know what to do, because the animals were so radioactive. And then they didn't know what to do. What are we going to do with all this meat? And they hated to throw the meat away. So there was a manual that went out to the meat packers, and it said, "We'll take the meat and grade it high level and low levels of radioactivity, and then take the low and the medium levels and mix them with clean meat and make sausage and send it all over the country. And take the high levels of meat and stick it in a freezer and wait until it cools off." So pretty quickly, the meatpacking industries are asking for more freezers, and they keep asking. And finally, in Gomel in Belarus, they just get some some refrigerated train cars, and they put the high-level radioactive meat, 600 tons of it. They jam it in these train cars, and then they send it off to Baku, and there the Geiger counters go off, and then they send it to Yerevan, to Armenia. And for 4 years, this radioactive ghost train circulated the western half of the Soviet Union. So just incredible stories of contaminated food.
And Medea, you've seen some of these children and met them. I know that you and Code Pink and others are right now running a campaign to try to get the Nobel Peace Prize for the Cuban doctors. I do want to circle back to you and ask you about that in a moment. But at first I want to get your personal take, since you have traveled to Cuba, you've seen this program in action. What did you come away with in terms of the impression of the children themselves, the program, and why it was so important in their lives?
I used to run an organization called Global Exchange, and we would take trips to Cuba constantly, and we always wanted to learn about, not do touristy stuff, but really learn more about Cuba itself. And so we tried to go with many of our groups to Tarará, where the children were, and we had to get special permission all the time. But after we did it a couple of times, we managed to keep going. And it was by far, I'd say, the most profound meetings and visits that people would have on the trip, because there were thousands of children there. It was an extraordinary program that this poor country of Cuba was extending and spending millions and millions of dollars per year on, providing all of the medical treatment for free, providing the transportation, the food. And people have to recognize, as you saw in the film, which by the way is so extraordinary, and congratulations to the two of you for this fantastic film, but to realize that in the first years of this, it was called the special period in Cuba, and things were very difficult. As the film shows, it was hard for people to get food. And we kept wondering, wasn't there resentment among the Cuban people that the government would be spending so much money on these children? But I think that over the years of the revolution, something that has really been instilled in the Cuban people is we do what we can for others. And so when we went to visit Tarará, you would see it was almost a whole city. There were, of course, hospitals, medical facilities, but there were also playgrounds and theaters and schools. And the Cuban doctors would tell us that the air, the sea were very good for the children. And they had all of these specialists that you saw in the film, the oncologists, the physiotherapists, the gastroenterologists, the dermatologists. It was and it is quite amazing that so many children were taken care of in Cuba with such intense kind of care at a time when Cuba was suffering and continues to suffer. And we'll talk more about the Cuban healthcare system in general. But I think it's important for the people on this call to understand that although this was something that was put forward by Fidel Castro, and he didn't want to make it into a kind of propaganda to show the world that what Cuba was doing, which is one of the reasons why so few people know about it and why the film is so important. But for people inside Cuba, we found tremendous pride among people that they were able to do something for these children and to do it in such a beautiful, thorough, and loving kind of way. Oh, and one thing I just wanted to add is that the Cuban children had been using this place that before the revolution was more an elite kind of place. Cuban children had been going there as part of their summer program because it has about 2 kilometers of gorgeous beaches. And so it was not only depriving Cubans of the income that could have been used for other things, but of the physical place that they love so much. But I found that so many of the Cubans we talked to gave those up willingly.
And picking up on that, actually, Medea, I saw another documentary. It was called Chernobyl en Nosotros, Chernobyl in Us. It's a Cuban documentary. And in that, they interviewed Julio Medina, who was the director, maybe still is, I don't know, the director of the Tarará program. And so, Sebastián and Rodrigo, I'm curious what Medina said about that program sort of reflects on what Medea was just saying, which he said, quote, it is one of the noblest tasks that we have not been asked to do, and perhaps the most noble that we have ever done in our lives. And when we were talking offline earlier, Rodrigo, you'd mentioned that when you both approached your father about these memories, he couldn't speak of them for a moment, that it choked him up. And I wonder if, for him, did he look back on this as the most noble of tasks along his long life? How did he see it fitting in?
I think that it's something that we try to show in the film. At the beginning of it, there is a sense of inconvenience. And I think that every human being is justified to feel that way. We cannot deny or ignore the political situation of Cuba. This is a group of people who were assigned to do something very often against their will. They were not receiving, for example, psychological training to deal with what they were about to see, which was children very sick and children dying in many cases. So I think that the reluctance of many of these professors and people who were thrown into this humanitarian mission was coming from the fact that they didn't feel that they were ready to do it. But once they got on the job and once they were on the ground doing it, I think from the research that Sebastian and I did, there is this common sense of understanding that it was bigger than them, and it was bigger than, if you think of the example of our father, for example, like he is a literature professor, and that there's nothing more abstract than the world of literature. And he is a man who is pulled away from this very abstract world and thrown into the most relentlessly real world, which is that of medicine. So I think it took some getting used to, but at some point you understand that it is perhaps not time to be talking about literature, and it's time to be helping these people. And it did not last forever. They were not reassigned forever. But at the beginning of the program, one of the flaws in the planning was that there were not enough translators. So they had to pull not only the Russian literature professors at the University of Havana, but also the senior students, those who were in their final year of Russian literature, for example, and already spoke Russian fluently. They were also sent to work as a translator. And this is the reason why Sebastian and I decided to name the film A Translator and not The Translator. And it's a nod to our understanding that our father was not the only person that did this job, but there were hundreds of people within the fabric of Cuban society that lend a hand to these children. For example, when we were doing casting sessions in Havana, we had this wonderful actress that comes in front of us, and she said, like, I'm so sorry, I don't know what the film is about. And, we give her the log line really quickly, and suddenly she's crying. And I remember Sebastian saying, I'm so sorry, like, are you okay? And she said, yes, and in the same way your father was a Russian literature professor who went to translate, I was a theater student who was sent to entertain them every now and then. So that there was such an effort, collective effort, that came together very quietly, very privately to help the children.
There is also an important component to take into account, which is the fact that in the late 80s, or even the first 2-3 years of the 90s, the level of commitment of the Cuban people with the government, with the revolution, with being beside, was way bigger than what it turned out to be afterwards. Because in '94 there was a big exodus from Cubans leaving the country. But at that time, because of that level of commitment that people still had, and their beliefs in the revolution and the social process was so high, people were not spending much time thinking about the consequences or thinking, should I do this or not? Like they were like working for a greater good, for a greater objective, right? Like, and this is like one of the things that we try to show also on the movie, and like how living in Cuba in those years was more about us than I. Like it's once you are assigned this kind of labor, it requires you to be a really, really bad person to say no and not to commit fully. Like you need to understand that at some point, we try to touch this in different parts of the movie, like, and it doesn't, like, this doesn't apply to Cuba or the revolution or the level of commitment, but like to being a good person, you know, like you always should be paying attention to the one that is beside you, and you should be able to help whoever is in need at the time that that help is being seek. You know, so we try to, coming from Cuba also, on the same line that what the Cuban doctors have been doing for so many years. I think that there were many other countries who offered help as well to those kids or affected otherwise by the nuclear explosion. So we try to address a little bit of those notes in the movie.
And I think that actually one of the most moving moments for me in the film was that moment when Marlene is really reluctant to do this, and he's with Gladys, the nurse, and he said, I didn't choose this. And she said, and neither did these children, or words to that effect. I'm sorry to paraphrase the script, but it was just this sort of stunning moment where, you know, she puts him kind of in his place, but she also gives him the context of what's happened to them. And following up from that, I think, Nora, you had wanted to ask, and it's sort of largely been answered, the question about how much awareness did Cuban civil society have of this program? Clearly a lot, but I think you wanted to also ask a nuclear power question, right? About did this change? Why don't you ask the question about their views towards nuclear? What did people make the connection at all, even between cause and effect? Nora.
Yeah, right. You already framed it perfectly. So yeah, I'm very curious, again, coming from the experience we had in Germany, very different situation again, much closer to Chernobyl. And again, we really had this shaking up within German civil society due to this nuclear accident. So I was wondering if Cubans, by experiencing the treatment by your health experts in your own country and sort of receiving so many victims being treated, then was there a big awareness within civil society of this health program? And then did that also lead to again also the awareness of the health risks of nuclear technology and sort of a similar anti-movement within Cuba and its society?
I think that one of it's a twofold question, right? Because you have to think about a small country only 90 miles away from the US with an economic embargo. And suddenly this nuclear plant represented an economic opportunity for many people. And it represented employment opportunities for many people. And it represented perhaps Cuba crafting their way a bit more predominantly in the international state. And I think that when Chernobyl happened, a lot of Cubans looked inward and say, you know, it's a tiny island. If we were to have an accident like that in Cuban soil, Cuba would not exist. Like it would wipe it. The consequences would truly be catastrophic. And I think a lot of people started reconsidering, including the government, whether it was a sensible thing to do and to, you know, put it into personal context, to give you a personal, not my own experience, but to give you an actual story. I have a friend who is in Paris and her in Paris at the moment, but she's from Cuba, and her mom and her dad were married in the 80s, and her dad was a nuclear engineer in Cuba, and he had been assigned to work in this project, and they divorced over it because he saw it as the only opportunity he had to actually be a nuclear engineer, and there was not going to be another opportunity for him to be who he had studied to be. And she said, I have to put my family first, and I have to put my daughter first, and I will not move our family there, and I will not be in a relationship with someone who is exposing themselves to radiation. So they split over that.
There's another movie that won the Lion Awards at the Rotterdam International Film Festival a few years ago, a Cuban movie as well by a close friend of mine called Carlos Quintela. He resides now in Madrid. And the name of that movie is The Project of the Century. And it's shot entirely in the place where the nuclear reactor was being built. So if anyone is curious about seeing how does that piece of landscape in Cuba, in Juragua, looks like today, that's your best opportunity right there. Again, the film is called The Project of the Century, and it's a really interesting take on three men that different generations that talk about the collapse or successes of that project and how that project translated to society, of course.
That's great. Thank you so much for drawing our attention to that. And it is fascinating that the Cuban government did start to realize, what the consequences would be on a small island, and of course even on a big landmass, as Kate wrote about in her book. And I want to address a little bit of that now, Kate, in terms of the consequences and the fatalities in particular, because in Traductor we see that not all of the children make it, and we know this is documented as well in the archives that this is the case. And of course, a whole lot more who never had the opportunity to come to Cuba didn't make it either, and yet the official death count of Chernobyl remains ridiculously low, even from some of the more so-called august bodies. I mean, obviously the 54 liquidators is completely discredited. You do a great job of that in your book, but why aren't these children, why weren't the children counted? The children that came to Cuba, the others that died, there's so many people who clearly were who died prematurely as a result of this disaster, but are not counted in any of the tallies. And what's that about? Why haven't they been counted?
Well, what you see in the archives is just a simple thing, really easy to catch, is a big bump in perinatal deaths. That's infants who die within 28 days of birth. And that goes right up, starting the summer after the accident, and it stays elevated. So those would be easy deaths to count. And what I see is that they're there in the archives, and the people in the hospitals, and we went down to the hospital records to make sure we were getting the story right. And so we can see that as information goes upwards from the county hospital to the county government, and from the county government to the republic government, and from the republic to Moscow, each time that information gets reprocessed and repurposed, it gets cleaner, and it gets there are fewer deaths and there are fewer health problems. And that's because, if your job was to be a public health official in the Soviet Union, your job was to say that the Soviet population is getting happier and healthier every day. And anybody who didn't report that, they would get a reprimand, they would get a fine, their data would get sent back to them, they'd say, do it right. So what's incredible is that we do have records that show people getting sicker, kids dying, elevated rates of cancers, elevated rates of about 5 different disease categories. People on the ground were so upset about this, like the Cuban, everyday Cubans were responding, witnessing this catastrophe, that they did break the rules, risk getting a reprimand from their boss, a fine on the job, risk getting fired, and some people did get fired, to report what was really happening. But as these, sort of political types who were Communist Party leaders got that information, they cleaned it up. So by the time it got to Moscow, it looked pretty good. If you didn't go into the details, if you just looked at the short summaries. So that's one reason we don't know about it, is that it was, everybody at the local level knew, but as the farther you got away from these localities, the less clear the picture became. Then in the early 1990s, the couple of UN organizations, first the World Health Organization, which you hear a lot about with the pandemic, and then the International Atomic Energy Agency, were asked by Moscow to do a foreign, assessment by foreign experts of the damage. And what Moscow leaders were trying to do was, there's a lot of political turmoil, a lot of people in the streets, a lot of people on strike, upset about the Chernobyl problem. And they wanted to bring in some foreign experts that said, don't worry about it, there's no problem, which is what the Moscow line was. And World Health, they did exactly that. They sent in 3 health physicists. They spent 10 days on the ground, and they said, you know, there might be a lot of health problems around here, but none of them caused by Chernobyl. But nobody believed a 10-day assessment by 3 guys zooming around. So then Moscow asked the International Atomic, what is it? IAEA.
Agency.
And thank you. It doesn't really roll off the tongue. And they did the same. They spent 18 months, sent in 200 scientists on short little 2-week junkets, and came away saying almost the exact same thing. You know, we saw a lot of health problems in these areas, but because the doses were too low, extrapolating from Hiroshima, we cannot say that any of these health problems are from Chernobyl contamination. And they've really held to that line so that we get this number of 54 dead. I've worked really hard with my research assistants to try to find a more accurate number. Ukraine gives compensation to 35,000 women whose husbands have died from documented exposures and a Chernobyl-connected disease. That number just counts men who were married, who were adults, who had documented exposures, who got exposed on the job. It doesn't include women, children, unmarried people, anybody else. At the 30th anniversary, the Ukrainian officials said that they counted 150,000 dead from just in Ukraine alone. Now, Ukraine got the least amount of radioactivity of the 3 countries that really got hit: Ukraine, Belarus, and Western Russia. We could not find any tallying of health records of any kind in the contemporary Belarus or Russia, and that probably has, you know, a lot to do with the fact that those are dictatorships, you know, authoritarian governments. So 150,000 appears to be the minimum number of death, and that's just from a place that got 20% of the radioactive fallout in Ukraine.
And I think you can.
I saw Medea wanted to say something. I think earlier. Is that
right? Well, you know, I'm going to sort of put over to Medea on this one because I think the numbers that you're alluding to, you just have to look at the numbers of children that have come into Cuba. You know, 26,000. Medea, you talked earlier, you saw thousands of children when you were there yourself. And then now we're seeing, 26,000 and counting. I mean, the program started again coming in. So the scale is obviously enormous. So this is a big program, but in fact, we don't hear a lot about it. We are hearing a lot about the Henry Reeve Brigade, as it's known now, the medical brigades that are traveling, I think, to 27 countries now to tackle COVID-19. They also were present in West Africa, treating Ebola, in Haiti with a cholera outbreak. I know that you and Code Pink and others have a campaign going asking the Nobel Committee to award the Nobel Peace Prize to the Henry Reeve Brigade. Can you explain to us why you feel that these activities merit the Nobel Peace Prize?
Yes, I had wanted to just make one interjection when you and Rodrigo were talking about the change within Cuba, and I think that was your question, Nora, about how that changed. And I remember how Fidel Castro's oldest son was a nuclear physicist who had been trained in Russia and was the head of the nuclear program there. And for throughout the 80s, there was just tremendous excitement about Cuba having its own nuclear power plant. And so to think of how dramatically it changed from the oldest son of Fidel being in charge to saying, well, it was the collapse of the Soviet Union that led to the collapse of the inability for Cuba to continue that program. But I do think it is important to acknowledge, as you did, Rodrigo, that what happened in Chernobyl certainly had an effect not only on the people, but on Fidel Castro himself. And then, Linda, what you brought up, I personally worked with the Swedish International Development Agency when I was a young nutritionist in the 1970s, and I worked all over Africa, and everywhere I went, I met Cuban doctors. In the most remote villages in the world, I would meet Cuban doctors, and I was just blown away by how dedicated they were, how much they cared about the people. And I had never seen anything like it. And so I ended up going to Cuba and lived there for about 4 years. and saw the health system firsthand. I was a nutritionist, and everywhere I had worked around the world, I worked with malnourished children. And I was told by the Cuban doctors, there are no malnourished children in Cuba. And I didn't believe them, because I knew even in my own country, in the US, there were malnourished children. And I got to Cuba, and so I studied the Cuban health system very closely, and I ended up having my own first child in Cuba. I am skinny, my husband, Cuban, was skinny, and so my child was skinny. And they kept insisting that this child was malnourished. I said, no, it's just skinny. So I'd have to get her weighed like every single week to make sure that she was fine. And it just is an example of how much care is put into each child. And the fact that Cuba has the most doctors per capita in the world, not counting, even counting the thousands of doctors who are sent overseas. It is an extraordinary system. And today, when we are facing this global pandemic, and we in the United States are the worst hit by it, and we see no end in sight, and we recognize that our system and our leadership is totally incapable of dealing with this crisis that is leading to people dying every single day. You look to Cuba and you see they basically conquered coronavirus. I don't think there were any cases in the last couple of days, and the total number of deaths were under 100. And it's because they have this amazing system where they send out doctors and medical students to everybody's house. Every single person gets checked up on. And it's a system that is also, you have to do what they say. There are certain coercive measures about it. If you are testing positive, you go to the hospital, whether you want to or not. You get quarantined for 14 days, and not in your own home. You go to someplace where you are quarantined. But this is really the only way where a poor country can deal with a crisis like this. And so I've seen the Cuban doctors around the world. I've seen how it functions inside Cuba, that a country that spends just a fraction of what the US spends per person per year on healthcare is able to rival the United States when it comes to life expectancy and for mortality, and now certainly conquering coronavirus. On top of that, to look at the thousands of Cubans who have now been sent to work overseas. Linda, I think it's about 30 countries now, from European countries like Italy to Angola to the Caribbean to Central America. No matter what you might want to say about any other aspect of Cuba, and whether you not like its government or not, you have to recognize that it is not only an extraordinary healthcare system, but extraordinary people who have been trained under the system, who willingly sign up, risk their lives, and go abroad in some of the most difficult circumstances. And that's what this Henry Reeve Brigade is. A number of us came together and said, this is the only example we see around the world of international solidarity coming from anywhere. And to recognize it's coming from this poor island nation is even more extraordinary. So the campaign is to award Cuba the 2021 Nobel Peace Prize. We were too late in the cycle for this year. And if you're interested, you could go to Cuba Nobel, as in Nobel Peace Prize, NOBEL, cubanobel.org. Sign up to not only add your voice to that, but help us in spreading the education about what Cuba is doing at this time, and how we as a global society can learn from Cuba's efforts.
Thank you, Medea. And I think, Raleigh, you had a good follow-up question to this about the sort of the irony of this extraordinary effort by Cuba abroad versus the effect of the blockade not letting medicine into the country. Why don't you go ahead and ask that, and then we'll get to our final wrap-up questions.
Yeah, so I was in conversation before sort of doing my homework. We have at the Goethe-Institut one colleague who is stationed, sort of posted in the German embassy in Havana. So he is sort of like the director of the liaison office for the Goethe-Institut in Havana. So I wanted to speak with him to see if he could give me some intel about what's going on in Cuba right now regarding culture and COVID-19. And he would have loved to have joined us, but instead I just spoke with him and we sort of transcribed the conversation. If anybody is interested in reading that, we send it out, but we can send it out again. And he pointed out to me that not only does Cuba offer free healthcare education to Cubans, but also people who are from poor circumstances, backgrounds, not only from developing countries, but also developed countries like the United States. And anybody who is apt enough to study medicine in Cuba and has the desire to do so can study medicine in Cuba. And the other thing he pointed out was that, of course, Cuba has free healthcare. However, because of the US trade embargo that's been going on with Cuba since 60 years now, it has been very difficult throughout the years, and also in the time of COVID, to get these supplies into Cuba. Whether it's because the United States will not send these things over to Cuba, or because the United States puts pressure on other countries not to send these things over into Cuba. And so, Sebastian, I think Rodrigo told me that you like to take on some political questions. So maybe I'll ask you, what do you think about that sort of ironic, that irony that is Cuba is such a ready and willing country when it comes to the population being afforded free health care, and their enthusiasm in educating people to be health workers. And yet at the same time, because of this embargo, there are so many things that they do not have access to when it comes to actually executing the goals that they have.
Well, my opinion, like I've seen, like I grew up in Cuba, and I have taken advantage of that medical system, and I'm like pretty well alive. So it definitely works. It used to work way better than what it does today. I haven't been in Havana in almost 2 years now, but we had, for instance, a situation when we were shooting our movie with our line producer, and she's a really severe allergies to nuts, and she was in contact with some nuts, and we had to run with her to the hospital, and she was stable within like 30 minutes after getting to the hospital. So definitely works. But there is also no secrecy or no mystery on how that or the fact that exporting medical services to the world is also one of the main sources of financing for the Cuban government. And there is ongoing investigation about how the Henry Reeve Brigade has been also treated or considered as a big human trafficking scheme, because of the fact that the doctors are getting only a small percentage of what they what the actual salary is being paid for those countries to the Cuban government. I don't have much information on that subject matter to like keep talking, but I am aware that this is also happening at the same time. And another thing that might have been playing against the Cuban system, the Cuban health system in Cuba for Cubans specifically, is exactly that same reason. Like the fact that we are sending so many doctors all over the place, all over the world, has made our health system in Cuba weaker. And the supply, you can blame it on the embargo or on bad administration for corrupt officials that exist in every single government in the world, are causing delays and pains, unnecessarily pains on the Cuban population. But with that being said, it's definitely it's a health system that has achieved many amazing things, and I trust that it will continue to do so. I have been also informed that they have been working with the Russians lately in developing a cure for the COVID-19 virus. So hopefully we'll get there. The Cuban government has developed a really strong system where it comes to develop vaccines and like biotechnology. So that is another thing that we could talk for many, many hours as well.
Go ahead, Medea. I think you wanted to add something about the flow of the money.
Yes, I think it's important because there is a huge propaganda campaign that the US government is doing to try to malign this program, try to get countries around the world not to accept Cuban doctors. There's even legislation that's been introduced into Congress right now to sanction the countries that allow Cuban doctors to come help fight coronavirus. It's all about Florida politics and the upcoming elections, and it's really quite grotesque. Sebastian, when you said that there are people who are complaining that the sending the doctors overseas is hurting the healthcare system at home, that's not the case, because it is one, and it has been the #1 source of income for the Cuban government, and that money is put into the healthcare system. So it's precisely by sending the Cuban doctors overseas that the Cuban healthcare system is able to survive as it has, given not only the tremendous blockade, but the destruction now not only of the support from what was the Soviet Union, but also what was the support from Venezuela. And now with coronavirus, not having income from tourism, the remittances way down, and that's part of the US tightening of the blockade under Trump, is that you can only send $1,000 every 3 months to your family, and all kinds of other ways that the Trump administration has tightened the embargo. I think the Cubans working overseas, the medical professionals, are a win-win, because it helps the countries where they're going. The doctors want to do it because they want the experience, they have the humanitarian mission, and they do earn more than they would earn at home. And the extra income goes into the Cuba government.
Well, I think there's going to be a very lively discussion probably in the Q&A as well. I'm just going to move things along a little bit. Sebastian, I know you wanted to respond to that, so why don't you go ahead, and then I'm going to move things back to the film itself, and so then we can get to some of the Q&A from the audience. But go ahead, Sebastian.
Oh, no, I usually want to say for the clarification, like each one has their own opinions on based on their life path, and like mine from being living in Cuba, and the information that I read or that I am aware of might differ in some cases, but I appreciate the clarification from you.
If I can very quickly, because I know that there are always important sides of this argument, I am incredibly pro singing the prize for the Cuban doctors. We also must acknowledge that, like every system, every country, Cuban hospitals at the moment have very, very precarious circumstances, many of them, and it's in great part because of the embargo, but also because there is things are being overlooked, and there are problems that no running water in bathrooms. You know, we cannot write everything off under the embargo. Not having running water in a hospital or not having air conditioning in an operation room are things that can be dealt more efficiently within our own, you know, the limited resources that we have. So very quickly to say, yes, both realities coexist in the same conflict.
In a scenario, yeah. And definitely, like, I have like no doubts whatsoever of the willingness and the kindness of the Cuban doctors. Our aunt is actually a physician as well, and we were raised in seeing as well that other than art, how the Cuban hospitals work by experiencing it firsthand. So we know how we have a good memories from those times.
Thank you both. And so we're switching tack a little bit to go back to the film itself with the final couple of questions from me. And I think Raleigh has a follow-up to mine. But again, when I saw this film at the National Gallery of Art, and there was a Q&A with the two of you afterwards, quite a few people hailed this film as a masterpiece. And I think one of the reasons they did that was, you know, it was an emotional film, and they've responded to that. But it was also probably largely an art audience. And so I think part of that was a response to the visual beauty of the film. And so I was wondering, you don't shy away in the film of showing the special period and the shortages of food on the shelves and the lack of gasoline and so forth. But I know you've also talked about wanting this film to present a different face of Cuba, not the crumbling facades in Havana that we tend to see, or the clapped down old 1950s cars, that there's beauty there too. And I wondered, Rodrigo, you know, how much of this was a cinematic choice, you know, in the cinematography and the way you framed the film, was that a deliberate effort to communicate this sense of the true beauty of the place, as well as the kindness and the emotion of what were going on with the children?
Absolutely. Thank you for asking that question. Sebastian and I come from a very visual world. As you all know, our mother is a curator, so we grew up in art galleries and museums and been informed by all this world of visual wonder. Because Cuba is a poor country, and because we came of age during the special period where there were not many films being produced in the country, I think that the understanding of how Cuba looks like has not been left in the hands of Cubans to craft. So you have, you know, US media portraying Cuba in a very particular way, under a very particular light, and then films about Cuba tend to gravitate towards the old cars and I always have a conflict with the representation of old Havana, because people always say, oh, old Havana is crumbling, but it looks very much like Venice, but no one says that Venice is crumbling, right? So Sebastian and I acknowledge that this exists, and we consume that part of Cuba, and we are that part of Cuba, but we also understand that we have this beautiful legacy of, for example, mid-century modern architecture that is usually not put on film. So when Sebastian and I were thinking about what kind of home they would like, we immediately say, oh, let's choose this. Let's go for the mid-century modern that hasn't been seen. And I see one of the questions in the Q&A referring to them as middle class. And the reality is, like, living in one of these houses doesn't necessarily make you part of a specific class. For example, we didn't build this home to shoot the film in, we rented it from a cab driver. So remember that a lot of people in 1959, between 1959 and 1961, a lot of people left Cuba and left these houses behind, and the revolution gave these houses to people who have fought for the revolution, or people who were doing occupying particular roles within the revolution. So it's very common to see someone who comes from a very humble background, from, you know, classic university professor, institution curator, living in homes like this. Sebastian and I grew up in an apartment. We decided to shoot it in a house merely because of logistics, to be, you know, to have greater freedom to move the camera and things like that, and to have, remember that there's 100 people behind the camera when you're making a film, right? So it's hard to do it in an apartment. But it was very much an intentional decision by Sebastian and I to have this part of Cuba also represented, and for it to start coming in the, you know, public conception of what Cuba looks like in the 21st century. Sebastian, I'm sure you have something to add to this.
Yeah, the other thing is, like, it's important. I've been having this conversation lately here in Miami on what the specific word based means, right? Which is like you are taking on something that happens and transforming it to your convenience. It doesn't mean that the film is an exact replica of what happened. We just took the basic or more important elements in that story, and with that story we want to build our own story. Like, and if you're in the process of making a movie and you have a specific vision, a creative direction, specific look that you want to go for, you just try to achieve it as in the most realistic way that you can. That doesn't mean that we grew up in that house. That doesn't mean that our dad had that car or the car was that color. There are like so many elements in a film. It's a fiction piece. It's not a documentary. So when you are working with fiction, you can bend reality as much as you like, right? So that's what our work is, to make everyone think or understand our story. And there are so many elements that are important in the story, but are more a vessel for us to convey the story than the element itself that is relevant on its own, you know, like the car or the house. But of course, we appreciate all those questions, because it seems that it has caught the eye of more than one person, and we have had that question asked several times.
But it usually comes from that question always comes from people. It's very interesting, because in the U.S. someone said, "Well, that's not the Cuba that I know," and we always say, "Well, which one is the Cuba that you know? When was the last time you went to Cuba?" And they say, "Oh, I've never been to Cuba," and I'm like, So the Cuba that you know is very much informed by the Cuba that a certain very particular group is showing you.
Beyond the Cuba, the particular Cuba that we might, each of us might know, it's specific to our life experiences. So my Cuba won't translate exactly to what your notion, knowledge, or experience of Cuba is. So it's always good to like have not to confine your concepts to one small or big box, but to leave it open to see what could happen, like what you could learn from the experience of watching the movie, or like whatever other material that you want to learn from.
Well, thank you both for that. It's fascinating. I've been reminded that we only have about 10 minutes left with two of our guests, Kate Brown and Medea Benjamin, who do have to leave us at 6:30. So Raleigh, maybe we should go to the Q&A now from the audience. And if you and Rodrigo, Sebastian can stay on, we have the liberty to go past 6:30, but we want to make sure we get some questions, especially for Kate and Medea, in before they have to leave us. So Raleigh, I guess, and Nora, I think, have been paying the most attention to the Q&A. Why don't you go ahead, Raleigh, and throw out the first one, and we'll go from there.
Yeah, of course. Thanks so much to everybody, first off, for all of the very active comments and engagement in the chat. It's been really nice to see all of the comments and questions roll in the Q&A and the chat. So I thought I would start off sort of a question that rather broadly, I guess, addresses topics that Rodrigo and Sebastian, you all have addressed, and also Medea and Kate. So this is kind of, I guess, something that anybody can really take on, but and sort of going off a question that Tomas just left. He said, "Are you aware that many Cuban nurses were assigned to go to Moscow to treat patients from Chernobyl radiation complications?" And that question sort of spurred a wider question that I have, and also that I developed when I was speaking with my colleague Michal in Havana, about how the USSR, after the collapse of the Soviet Union, sort of left Cuba hanging, and economically speaking, Cuba was struggling, and Cuba went into the went into the special period, as it's known, and the question sort of arose. The people of Cuba, the doctors and the other health workers, nurses, technicians, did they have any sort of sense of these people are coming from a country whose government failed us? Or did they see it in a sense of these people were also failed by their government in the same way that Cuba has been failed by this government? And we, in a word that I think that a lot of people have used in this conversation, in solidarity and in the interest of humanism, are obligated to help these people no matter where they come from. And I think somebody also commented on the idea of individualism versus humanistic sort of drive to do something for the greater good. So yeah, that question kind of bundles a lot of questions and comments people have made about what really do you think drives that willingness of Cuban doctors to either have people come to their country where they already have very little to give, but they give whatever they can to help these patients, and also that they are going abroad to help these people? And what do you think, what sort of drives that, in spite of the fact that, many of these countries have turned their backs on Cuba for various reasons, or been pressured to do so?
Well, I can start out on that. I think because of all the years and having your father as this just incredible example, how he loved Russian literature and taught it, and then to see the evolution at the end of the film of saying, well, nobody wanted to take these classes anymore, like who wants to learn Russian now? There was a period certainly where there were tremendous ties between the US and Russia and a lot of intermarriage. You had people who were working in Cuba and ended up marrying Cubans. You had many Cubans who were studying in Russia and ended up marrying Russians. And even though the societies are very different, and I found that Cubans feel much closer to Americans and US culture and football and US films and all of that than they do to Russians, there still is a deep connection over the years. So going back to Russia and taking care of people who they had been in contact with for many years is just part of, I think, a follow-up and the ties of friendship that change even when governments change. And let's remember that the Ukrainian government became a capitalist government. And even so, the Cubans kept treating the Chernobyl children during that time. And then to talk about how it is today, I think, I don't remember if it was you, Rodrigo, but, oh, maybe it was somebody in the chat room saying that most Cubans would love to leave the island. Well, you know, who doesn't want to leave where they're from and learn about the world? And especially if you're from a poor country, to be able to go to a more wealthy country. But in the case of Cubans, a lot of the medical professionals who sign up for these, they just want to see another part of the world. They want to learn about more of the world. And this is a chance for them to travel and be able to contribute and make some money at the same time. So I think not just, I mean, certainly there's a tremendous idealism among Cuban professionals, but we have to remember they are people as well who like to learn more about the world, who like a chance to make more money if they can. And this is a way they can do that.
And actually, if I can just jump in there and go to Kate on this, maybe in November, there might be quite a few people that want to leave this country as well, depending on which way things go, even now. But Kate, I mean, the question I think was also about doctors and nurses going to the Soviet Union first. And I believe that is what happened, that they went there first and learned on the ground. Did you come across that in your research, these Cubans who
didn't really? No, I didn't. I'm sorry. That was probably more centered on a specific hospital in hospital number 6 in Moscow, and then and number 2 in Kiev. And I didn't have access to those records. But those were special places that dealt with radiation medicine, and so no, I don't know anything about that.
Oh, and Linda, I forgot one thing, because part of the question was, do they feel resentment? And certainly the government of Cuba has a lot of propaganda about supporting governments that are friendly towards Cuba. But you even see now during this time of coronavirus, where the Cubans are sending medical brigades to countries that are pretty hostile towards the Cuban government, like the Honduran government. So it does transcend ideology when it comes to helping people in a time of crisis.
I think an example of when Katrina happened, Fidel Castro put, I don't know the exact number, but in the hundreds, doctors with backpacks ready to go, and he called Bush and he said, just say go, and they're ready, and Bush said no.
Right, that's how the Henry Reeve Brigade started. It was created, named after an American who had helped Cuba in the 1800s in their independence war. But it was created right after Katrina to be able to offer assistance. But as you said, Bush refused that.
So on that, I also have questions that maybe are, or sort of pulled a few questions that might be answerable by especially Kate and Medea. So when we were sort of having the dress rehearsal, Rodrigo and Sebastian mentioned a couple of things about how and you also see this in the film about how the people who were treating these patients that were coming into Cuba from the Soviet Union, the former Soviet Union, there still was sort of like a quietness about what exactly it was that had made these people so sick. And I remember Rodrigo or Sebastian, you mentioned also that when you were speaking with a doctor who had himself become sick, even when he was passing away soon from cancer, there was a very, he was very hesitant to admit that he was getting sick from exposure to the same radiation levels. And so I was curious, and a couple of people have sort of touched upon this, about to what extent people were admitting that this was a problem that came from radiation exposure at the time, and where are they right now in terms of that issue, and how did they sort of come to the point where, or have they come to the point yet where they've acknowledged fully that, at least in Cuba, that these people were being treated for radiation related illnesses?
Well, I don't think that it is now a taboo or a problem to talk about it. And I think that we mentioned that when we interviewed this specific physician, he was the one who was sent by Fidel directly to go to the more affected areas in Ukraine and Belarus, and he was the one who basically handpicked the first one or two flights. The first one being with like 180 something people, between kids and their relatives, and we think that he had already also, other than cancer, dementia. And what Rodrigo proposed was that he might have been in a loop where he thought that he was still in that situation, and the instructions at the time might have been to neglect that everyone or anyone was dying from anything related to the explosion. But like, as we all know, like they were, and there were a few of those kids who did die in Cuba, and that's like something that you cannot, no one can deny it. And it's not related to the lack of efficiency of the Cuban health system or anything other than the advanced degree of deterioration that those folks had when they arrived in Cuba. I remember that in that interview, the same doctor said that he did bring a bunch of kids who were affected directly by the explosion, but that he also brought to Cuba a few other kids that were sick beforehand, and it wasn't fair to bring only the people affected by the explosion. So they wanted to help as much as they could.
Hey, you talk about that in your book, actually. I mean, the same sort of thing, the same kind of level of denial that went on, and then so how radiophobia really took off, that this was all just stress and not related to your actual exposures. You want to touch on that a little bit? The sort of flip side of that story was true also in the former Soviet Union.
Yeah, I mean, the people who associated or asked questions about the spike in illnesses they were seeing, the health problems they were seeing in their families, among their kids, or in their own bodies. There was just a couple of standard answers. This term radiophobia had been created some decades before during the Cold War, but it was really brought out and used generally around the Chernobyl zone. These people are phobic. Anything they get, they attribute to Chernobyl, to radioactivity, because they're stupid farmers, that kind of thing. The other accusation would be that that it's their own fault, that they drink too much, they have poor diets, they smoke too much. And the interesting thing is that this all occurred in 1986. Russia was in the middle of a big prohibition period. That Gorbachev had gotten rid of all the vodka and the wine and the beer, so that Soviets were more sober. And so you see in this period this big jump in positive health scores. That people are living longer lives, fewer people are dying, fewer people are suffering from exactly alcohol-related illnesses. In fact, the Soviet longevity, it's longest in the second half of the 1980s. But in the Chernobyl lands, those numbers are flipped. I mean, you really do see a big difference. And then in terms of help from socialist countries and how quiet there was about it, all kinds of countries in 1986 offered help to the Soviet Union to help clean up the accident and to help treat people. And the Soviets only took help from socialist countries. So they said no to the Americans and the West Germans and the Brits, and they said yes to the Cubans and the Czechs and the Bulgarians, etc. So and I think a big part of that, and you can see it in the directives to the media, was we're going to keep this on the down low. We're going to quiet about the fact that we need medical help and other kinds of technical support to deal with this accident. So that's why Cuba could be really helpful, because they had a great medical system and could do things that they didn't do so well in Russia, which is bone marrow transplants and things like that. I do have to sign off now. Thank you very much for hosting us.
Thank you.
Thank you, Kate.
And it was great to meet you, and thank you for the film. It was fantastic.
Yeah.
Thank you, Kate. Good evening.
Thank you for joining us.
Bye-bye, everyone.
Yeah, and I have to sign off too, but I wanted to say how extraordinary I think the film is, and what an honor it is to meet the two of you. And thank you, Linda and the Goethe Foundation, for putting this together and bringing together such fantastically relevant issues in a story that goes back decades, but really tells us a lot about what we need to do today. So thank you for letting me be part of this.
Thank you, Medea. It was really great.
Thank you, Medea.
And we can, I think, stay on a little longer if you, Sebastian and Rodrigo, are able to, and maybe a couple more questions.
Of course, yeah.
Yeah, and I do want to remind people that if for whatever reason you did not watch the film before this program, you did get the link in the Zoom reply with the password, so you can still watch it until July 27th. We're very pleased that the distributor has allowed us to keep that link active for a few more days. So, or maybe you want to watch it again now, informed by some of what you've heard tonight. So please do watch the film. Tell everyone you know about it. It needs to be seen far more widely, I think. For me, it was a real testament to what this technology does to human beings. It brought it home in a sort of microcosmic way on a very personal level. I think, we'll get to one more question, but the other most moving moment for me was Alexei's father talking about the irony of him actually being a worker at the Chernobyl plant, how proud he was, actually a teacher of the engineers, I think, how proud he was, and then how ironic it was that radiation treatment was being used to treat his son. And he says, how much radiation can one body take? And that, of course, is fundamental to the whole issue. Is such a sad and beautiful moment. But Raleigh, why don't we do maybe one more or two more questions from the Q&A. Let's see what else people would like to know. And we appreciate you both staying on. I know it's quite late in Paris, but maybe things are just getting started, or they would be if it wasn't under COVID conditions. So go ahead, Raleigh. Let's see what else is in the Q&A queue.
Yeah, so first off, thanks so much to everybody who has submitted questions that are very more oriented towards activism and nuclear related, anti-nuclear related topics. Those I think were probably best suited for Medea, so we apologize if we couldn't get to all of them. These questions are going to shift kind of more towards the filmmaking side, since we do have two directors with us, so we're going to go in that direction a little bit. So a few people have asked questions about what it was like for the two of you to go to Cuba and film this film. Margaret has asked about the politics of making the film in Cuba, because both of you live outside of Cuba, or you divide your time between somewhere else in Cuba now. And so how was it to go back to Cuba and make this film? Was the government involved in any way? Did you have to get clearance? And somebody else also asked a similar question about returning to Cuba in terms of shooting on location, Tarara, or the house that, like you mentioned, the house that the family lives in. It's sort of a mystery to me too. Just I've never watched a movie shot in Cuba that I know of. So I'm just curious, what is it like to make a movie like that in Cuba?
Well, it's we have a solid relationship with Cuba. We have many friends there. Like, it's not that we live outside and we don't go to Cuba. We don't care about what's happening there or anything like that. Like, we have a really strong bond, and we try to keep it like that. We try to go as much as we can. And it happens that during the process of shooting the movie, I've been having other projects, so I do go often to Cuba to shoot and like produce more content over there. It is there's a movement of independent cinema that started in Cuba in early 2000, like around 2001, 2002, that us, my brother and myself, and many other young of our generation filmmakers have had the pleasure to belong or contribute to in one way or another. The thing is that you always will need permits, and you always will need to be clear with the authorities. Otherwise, you're gonna get your equipment confiscated. That is not something that happens to Cuba specifically. Like, if you shoot anywhere on the street, you would need a permit of some sort from authorities in order for you to like block traffic, move actors, do everything in a safely way, right? Like, safety, it's a top priority in our lives, as it should be. And filmmaking is not away from that. There's like a high degree of risk of things to go wrong. So myself as a producer, it is like you're always trying to think ahead, I don't know, as many steps as you can in order to prevent things to go in an unfortunate way. So yeah, it's like that. We have like so many experiences with Rodrigo. I'm pretty sure that he would like to tell us a few of those.
I mean, the first one that I always tell is that we arrived in Cuba on November 23rd for pre-production, and Fidel Castro died November 25th, 2 days later. So that, you know, shifted the country into funeral, national mourning for 10 days, and we couldn't get a meeting, we couldn't get a permit, we couldn't get into anything. But then Sebastian touched on that we did have immense willingness from the Institute of Cinematic Arts in Cuba. And I read a question about whether we had shot in actual hospitals. And no, we did not. And it's not because we couldn't get permits, but because there is a great liability when you bring, you know, actors and crew to a hospital. You're both exposing the sick people who are in the hospital and exposing the healthy people who are coming into a hospital where there might be infectious disease. So because of the liability issue, and because we discussed it, and we didn't want to disrupt the daily operation of a hospital with a film crew, that, you know, with a film that we could shoot somewhere else, but we did shoot it in the medicine school in Havana, which, because it is a med school, already had labs and already had a lot of things that we would use. And because it was a small budget, there were many things that the production designer were like, yes, we can use this. But I remember when we were in the process of securing the permit, the director of the school came up to us and almost with teary eyes, she said, it is an immense honor that this film is being shot in our school. Yeah. And Sebastian and I were like, oh my God, no, like, it's our honor to shoot here. But, you know, it goes to speak about what we were talking earlier about whether people have been resentful about the Chernobyl mission. And no, like, I think people really understood that it was a time to come together and help. And this woman, as a director of the med school, remembered the role that she and so many people have played. So she felt incredibly honored that it was happening in her turf, and we had so much help coming from Cuba.
Yeah, I think that in, like, whatever it is, the level of dialogue that you're trying to have with the authorities in order for you to like get your permits or like get or organize the logistics around the film, it has to be a respectful dialogue about everything, because there's a thin line where if you said something that it's misinterpreted, you're putting all your production at risk, but not only for the production, but for the sake of like good communication, a good understanding, and having everyone on the same page. So yes, we did have to submit our script for scrutiny from like a censorship board that includes like top officials from the Cuban National Film Institute. But again, like, the dialogue has to be respectful, and we have to agree on what we're going to be doing, and the result cannot be far from what we said that we were going to shoot, you know. And like Cuba, with the system as it works, usually you are being seen from authorities, especially when you are shooting a project of this nature about this subject matter in a country that doesn't have a huge film production. So it's not usual for Havana to host a production of the size that we had ours. Even though it was small budget, we still have some facility, some level of movement. So you always have to be careful for the sake of the industry as well. You don't want to set a precedent that can be harmful for other filmmakers that have a more fragile approach or health in the Cuban film industry. On the other hand, and switching a little bit, it was newly achieved new decree that basically created a fund for Cuban filmmakers to apply. It's a fund that is going to be run by the Culture Ministry in Havana. And finally, after almost 10 years of debate and meetings, there's this law now that protects producers and directors and people who work within the film industry, and they are basically like give us legal protection. So we can now in Cuba have our production companies legally registered. We can operate with foreign production companies who are going to Cuba. And it's not that in Cuba Cuba doesn't have a high production level, but like it's small, like way smaller considered when you compare to the US or Europe even, right? Or even like countries in Latin America like Mexico, Colombia, Chile, and Argentina and Brazil, who are like the largest film producers in the region by far. Like they're like not that far from what Hollywood produces each year, like specifically Brazil and Argentina. So we are way far from that, but each day there's more people who are interested in producing and creating their work from Cuba, which is amazing. And we have seen that happening. We have seen the results in all the film festivals in the last 10 years coming from Cuba.
So I have just two other questions that I was going to pose based on the Q&A and chat, but I first wanted to ask Nora and Linda, is there anything you all have noticed from the Q&A and chat that you would like to pose before or instead of, you know, what I was going to ask, because I don't want to steal all the thunder.
You go ahead.
I'll go ahead.
Thunder.
Okay. Nora, did you have anything that you wanted to ask? Okay, so the one other thing that I noticed that a lot of people were submitting questions about regarded the wonderful way that you all portrayed the family dynamic in this movie, the relationship between the husband and the wife, and of course the role of the young son in the movie. And so so I'm kind of combining a few things that people have asked. So first of all, yeah, regarding the family dynamic, the way that the political and sort of ideological, cultural points of view, the way they differ between the mother and the father in this film. Somebody asks, has that been something that your parents have handled, if that is something that you're comfortable with speaking on? But if not, is that something that, in general, families in Cuba during this time, is it something that was a divisive topic between families? I remember somebody mentioned, you know, that that one person being placed on a nuclear power plant project, the disagreement between the married couple caused a divorce. And so it does seem like something that the Cuban people are very passionate about, and you know, and husbands and wives or brothers and sisters, you know, they will go, you know, come head to head when it comes to disagreements on these things. And so, yeah, the question about your portrayal of the family dynamic, and how much of, if you want to say how much of that is personal, or how much of that did you sort of draw from your experiences as Cuban people, with knowing Cuban people, if that makes sense.
Sorry,
I saw.
before you reply, I need to step out of the conversation for like 10 minutes, but I'll be back in 10 minutes. So thank you so much.
Rodrigo, this one goes to you then.
Okay. I saw the question come in, and that person used the term ideological difference. I don't think our parents had ideological differences. And you know, and if that's what they read, I love it, because that's the magic of film, right? Like, it's so subjective, and we all understand different things, and we all appreciate, and also like what we bring to a story, right? Like, your own personal experience informs your understanding of the story. What we tried to achieve was that practicality that is broken. You know, I think that a good marriage is very often a machine. And at the beginning of the film, we show you how that machine is perfectly in sync, right? You know, like, he has his job, she has her job, and the child goes to school, and he picks them up, and they go grocery shopping, and all of that is about to come, you know, flip on its head. And she remains very level-headed through a crisis. There are people who are very good at handling a crisis, and there are people who are not. And she is only dealing with one half of it, which is the economic crisis. He has to deal with the suffering that he's witnessing, and also the economic crisis. And I would say he's not as good as keeping himself level-headed when it comes to trying to find the equilibrium within his job and his family. It did not trigger our parents' divorce. We got through that period, and they only divorced 7 years later, after, for other reasons. You know, couples fall apart and make it through crisis. They made it through that one. They get along really well now. I think Sebastian had a child 3 years ago when we were shooting the film. Actually, that shot of when Isona goes to the hospital for an ultrasound, and we see the little monitor with the ultrasound, that's Sebastian's baby. His partner was pregnant at the time. And I think that was the very first day of production. We shot that. It was the second shot of the day. And I remember my dad and my mom and a bunch of people were in front of the monitor, and we shoot the scene. My brother and I are very focused. And when we come out of the set, everybody's crying. And it's because together as a family, they had seen the ultrasound of their first, and that is the first grandchild that they had. So after that, I think a baby always brings a family together. They were at the world premiere of the film at Sundance. So, you know, like, I think the film has brought my family together. I think it was a healing exercise that we all engaged in.
And, you know, you mentioned the role that your father played when you all called him and asked, you know, can you sort of write down some of the memories? Some people also asked, what was your did your mother have any input in how her part of this story was told? What did she have to say in the process?
They were, so Yoandra Suarez, who is the actress that plays Isona, our mom, they met a couple of times. And I would say Isona is a far more accurate representation of our mom than he is a representation of our dad. Because our parents are not public figures, we never thought it was important to get them down 100% the way they are. So instead, we put things on the table, like personality traits that for us were very interesting about our parents, and that would be fitting the story, you know, like the introvert and the extrovert and things like that. But for Yoandra, during her preparation process, it was very important that she got my mom's mannerisms. And I might be biased, but I think my mom has beautiful mannerisms. So we didn't care. We said, sure, talk to her many times. And in the, like, it got to the point that she, in the film, is actually wearing jewelry that my mom wore in the 80s. She still had it. And she was like, oh, can I borrow this? Can I borrow this? And then she met with the production designer and she said, can this live in your world? So the ring that Isona always wears is my mom's ring from the 80s, and her earrings. So yes, she did. But most importantly, I think my mom's stamp in the film is that every single piece of art that you see on a wall was put there by our mom. So
And actually, oh, sorry. I was going to say, actually, somebody did ask, it was about Sebastian's wall behind him. They were curious whether the artwork behind him.
No, it's not our mom. But Magda curated she curated two exhibitions. So everything that you see in the gallery when she's curating that show, and then you have the disastrous opening where everyone is caring about the food and not the art. Every single piece of art in that gallery is actually from the 80s. She did a very extensive research process and found artists in her network. She's incredibly well connected in Cuba. And she borrowed pieces, and very generously, all these people lend their work without charging us a cent, because they wanted to be, these people, many of those artists saw us grow up, right? Like, we played in their backyards and suddenly they're playing filmmakers and making films. And every single piece of art that you see in their home is made by a contemporary artist recently, but we thought it would lend itself well to the 80s aesthetic. So yes, in short, incredibly well, involved in the film. And then when we finished it, we showed both mom and dad a rough cut on the film for them to give their feedback. And I thought, my brother and I remember had a conversation, and we said, is it even worth it? They're going to start crying and they're not going to be objective. And the two of them came with notebooks. And they were like, okay, we're going to give you notes. And they actually had very constructive criticism that was incredibly objective and not at all related to, the idea that they were being portrayed in film.
Yeah, that's wonderful. That's wonderful. Yeah. Sorry, there is actually there've been a couple of questions about the nurse, the Gladys character,
yes.
and you were talking sort of the juxtaposition about your parents, being introvert, extrovert, and that seems to be. I mean, not that she's an extrovert, but she's definitely got a much more pragmatic approach to the problem at hand. She's sort of, at first at least, you get a sense that she's quite unemotional. Was she a kind of? So I think somebody asked whether she was a real person and whether you got in touch with her to get the. Was she a composite of people, or was there somebody that you interviewed in advance who informed that character?
The recollections that we have from her were given to us by our dad. So he remembered the interactions that he had with this nurse. So for example, one of the creative licenses that we took, that nurse was actually a Cuban woman in her mid-50s. So chances are, if she's still with us, she would be in her mid-80s now. So we didn't interview her for the film. The reason why she's an Argentinian in the film is because Sebastian and I met this actress in Toronto. She came to perform a monologue, and she's a friend of a friend. And our friend said, can you please show her around or get together for dinner? And we're having dinner and she's talking, and my brother and I looked at each other and just said Gladys. We knew the second we saw her that it was her. So we spoke with Lindsay Gosling, who is the producer, co-producer and the writer of the film. So we rewrote that character to accommodate her accent because she is from Argentina. And we met her, an Argentinian nurse who had escaped dictatorship, which was very often in Cuba. There were a lot of people who moved to Cuba in the 70s from other Latin American countries, escaping the military dictatorships.
And you had a bigger challenge, really, with Rodrigo Santoro, I would think, who's a Brazilian actor who didn't speak Spanish or Russian. And I found that phenomenal, that he had to sort of memorize the script without necessarily knowing even.
Thank you for bringing that up. I saw a question, and I don't know if the person who wrote it is still watching. And the question was, is this an international cast? And I saw the use of quotation. And I respect I think that I understand what those quotation means. And, you know, there is a lot of criticism with films like Wasp Network that just came out on Netflix because it is a film about Cuba, but there's only one Cuban actress who has a small role, Ana de Armas, and then all these big roles are given to international stars. There's definitely an issue in that, in which you're not allowing Cuban people to craft their identity and the perception of the public identity to the world. And I understand that we wanted to work. Having said that, we wanted to work. I never considered that the film has one lead character. Sebastian and I consider that the film has three lead characters: Malin, Isona, and Gladys. I don't think the story could exist without any of those three. And we had indeed an international cast. He's from Brazil, she's from Argentina, and Joandra is from Cuba. Not only that, our cast, our crew was very international. We had people from 10 different countries on set at any given time. We have people from Australia, from Spain, from Chile, from Cuba, from Canada, from, God, like 10. I remember we count them at some point, so we have people from 10 countries.
Rodrigo, translator for the Russian kids? I mean, you maybe a translator of your own for them.
So we had, and we had many versions of the script. We had a script in Spanish, we had a script in English, we had a script in Russian, we had a script in Cyrillic for the Russians to be able to read. So it was really an international effort, and I think we take pride of that. We take pride of the fact that we're talking about an international humanitarian mission, and we put together a very international cast and crew. Rodrigo Santoro, we always wanted to work with, and we were doing cast in Cuba, and we didn't find anyone who spoke Spanish and Russian and could also deliver what we were looking for. So at some point it became very obvious that we were gonna have to find someone who could at least learn phonetically. So Rodrigo is from Brazil, and he spoke Spanish, you know, here and there he gets by. Russian, he had no clue whatsoever. And I remember our first meeting was in a hotel, in his hotel lobby in Miami. And his first question was, guys, why me? And we said, like, well, you know, like you played Raul Castro in Che, and he's like, I had one line in that film. And we were like, well, you did it really well. And he asked for some time to have 2 lessons with a Russian professor to see if he could even get his tongue around speaking in Russian. And then he called and he said, okay, let's do it. So he only had 2 months to learn everything phonetically. So the Spanish he understood, but it's very interesting because when we were doing the Brazilian premiere and all the press junket, all the Brazilian journalists were like, say something in Russian. And he's like, I don't remember a word. He forgot. It's like, do you remember when you were in school and you had a history exam the next day and you learned everything and it was like pinned in your brain and a week later you didn't remember? That's exactly what he did.
That's wonderful.
Yeah.
Well, we could probably, we were thinking we should probably sign off at 7, which is 1 in the morning for you, Rodrigo, but your brother hasn't returned, and I hate to cut things off without being able to thank him in person. So are you good for one last question?
Yeah.
Maybe Raleigh will go for one more round of
Yeah,
questions.
I did have, it was sort of supposed to be the closing question, but Rodrigo, you mentioned previously that, you know, in previous, especially when this film is screened in America, and you've spoken with Americans about this film, US Americans about this film, and you've had people say, well, this isn't the Cuba that I know. And you say, well, what's the Cuba that you know? And they're like, well, it's this. And you're like, well, have you been to Cuba? No. You know, and then, and of course, there is that sort of in the United States, you know, people still think about that kind of old Havana look and, you know, certain details about Cuba that does not really paint a full picture or an accurate picture of what the country is actually like. So it's maybe a bit of a, how would you say, cheesy question, but what, if you were to, what do you tell people when you say, what is Cuba to you? Like, I mean, you're from Cuba, so I mean, that might be kind of maybe like paradoxically difficult to say, but what do you want people to know about Cuba who come to you with sort of an ignorance about the country?
Yeah, before I answer that, I think obviously my favorite Q&A, my favorite presentation was in Cuba at the Havana Film Festival. We had this gorgeous screening with 1,500 people at the Yara Cinema, which is an iconic cinema in Havana. And like I always say, my next film deals with Alzheimer's, so I've been doing a lot of research on Alzheimer's, and I always say that I will not forget that moment, even if I'm diagnosed with Alzheimer's one day. But after that, my favorite screenings are always in the US, because I think that Cuba remains such a mystery to Americans, but at the same time is so present in the collective, imaginarium of Americans. There's always a talk about Cuba, and you're not allowed to go to Cuba, and the second you're not allowed to do something, that's all you want to do. And people think that
Cuban cigars.
exactly, and everybody I meet in the US seems to be an expert on Cuba, which I adore. But I remember when we were at the world premiere, this is January of 2018. Oh, there he is.
There he is.
Can you hear us?
Hi, I'm back.
There you go. I'm talking about the world premiere at Sundance. And, this is January of 2018. Trump has been in power for 1 year. And there is always a tendency for people to, at some point, try to sneak a political question in the Q&A. They always talk about the creative side. And then, my God, the things that Sebastian and I have been asked was like, what is your stance towards socialism? I'm like, not here. Ask me outside. But at one of the Q&As, which is a very leftist crowd at Sundance, someone said, what is the future of Cuba? And I remember we said, I'll answer that question if you can ask what the future of the US is under a Trump administration. And then everybody was like, wow. But, now answering your question, I think that what I want people to understand about Cuba is that it is not your virgin paradise for you to enjoy. There are 11 million people wanting this country to open up to the world and to be part of the world and to be able to interact in ways that we're not able to interact now. And there is something very common that you hear all the time, especially after 2016, which is, I want to go to Cuba before it changes. And I always tell people, well, you should have gone in the 70s. So the country has changed. And I think that for people to say, oh, but I don't want a Starbucks, and I don't want McDonald's, and I don't want this, and I don't want that. It's like, sure, I don't want it neither. But I want people to have the opportunity to say, you know what, I don't want that. I have better places to have a coffee because this country has amazing coffee. So what I want people to understand is that it is, and it seems to have been for a very long time, it is an island in transition. And yes, there are the cigars, and yes, there is the sports and the dance and everything that we're known for, but there is so much more. And I encourage people to try to look a bit deeper, try to look beyond the crumbling facades of old Havana, and trying to look beyond, the fabulous dancers and the cigars. There is a lot more about Havana, and there is a lot more about Cuba.
It's like, to in that same question, I feel like when people react in that way, like, oh, I want to go there before it changes, and I don't want McDonald's, I don't want, it's like, well, it's not on your power to choose. Like, it's up to the Cuban people to choose if they want McDonald's or Starbucks or whatever other company, not from the US even, because the reality is that it's that being McDonald's or Starbucks or whatever European, African, Asian company that sells in Cuba, that represents employment opportunity for our people, that it's much needed. And I hope that at some point we could in Cuba interact with the rest of the world in a more free way, at least business-wise. I am aware that the Cuban government just rolled out a few economic measures within the past days. and they have started implementing those. It's still early to make a judgment on how effective those will be, but it's definitely it has definitely put people to think and to work in to try to accommodate again to the new economic change that they are proposing, and those include a lot of exports and importations from middle and small enterprises in Cuba, and eventually, because of the restrictions of the Trump administration into the Cuban government specifically, and I know its people, although it's affecting more severely its people than the government, and the rampant corruption that exists in many instances of the government in Cuba, and that is like also well known and accepted by even the president has addressed those issues in national television. We hope that with constant work from the Cuban people, we'll be able to like see more interactions with the world for the better of the country in general.
Thank you so
Thank you.
much. Well, it's really late now, I know, for some people watching. We've had incredible accolades in the chat and the Q&A for your film and for the level of conversation that you and our other two guests have delivered tonight. So on behalf of everybody watching and Beyond Nuclear, thank you so much for doing this and for joining us for all this time. I'm going to let Nora maybe say a quick goodbye as well, and then Raleigh, wrap things up, let people know, especially about Michael Toss's document, where they can see that.
Yes,
A reminder that you can still see the film from the Vimeo link that we sent you until July 27th. And we will endeavor to look at some of the comments and questions in the chat and the Q&A. And if there's anything that we at Beyond Nuclear can respond to later, if you want to contact us by email, we'll endeavor to do that. So Nora, why don't you give us some parting words as well?
I just want to say a big thank you to Sebastián and Rodrigo for joining us, and especially for taking so much time now. But you have seen that there was so much interest in the chat and the Q&A, and it was nice to see all the questions and comments. And I think you all brought us together thanks to your film and this discussion. So thanks so much. And I'll say buenas noches and gute Nacht.
I wanna thank also all the participants and to all of you guys for organizing this. Linda, thank you so much for your patience and for chasing us for so long since the moment that you saw the film in the airplane. Thank you for all the questions and for all the reactions towards the movie. We have been secretly reading those on the side of our screens. So thank you so much, and we hopefully we'll be able to share some new material with all of you guys.
Great, thank you.
yes.
And just to echo Sebastian's words, thank you so much. It's, I think it's the first time Sebastian and I do a virtual Q&A. So it's always interesting to see that people's passion, moves from one meeting to another, and it's equally as incredible to do it in person as it has been with you all tonight. So I thank you for organizing, and the people watching. Thank you for your interest in Cuba, and thank you for your interest in Cuban arts. I think that there is so much happening in Cuban filmmaking now with a new generation of independent filmmakers that are pushing to change so many minds and so many conceptions about our country. So thank you. And
yeah, so thank you so much to Sebastián and Rodrigo, both for making this film and for allowing us to show it here and to open up to this virtual sort of format that we are having that we're all sort of new to. And thank you to Linda and Nora for being such great partners again this year. And I'm really glad that we were able to work something out, even in spite of what's happening with the isolation and the quarantine. And of course, thank you to everybody who is currently still in here and who was previously in here for your questions and for your wonderful engagement. We really appreciate it. And we really appreciate especially all of you supporting our programming here in the United States, in Washington, D.C. area, or wherever you are in this time where we do have to take things virtually sort of indefinitely. So it's really nice to see that people are willing to come online and to engage with us in this way. And just as a couple of side things, we are recording this webinar, so we have a YouTube channel for the Goethe-Institut Washington, so we can send that link out for the webinar in case you loved it so much you want to watch it again, or in case you would like to send it to somebody maybe who didn't get to watch it. And also, I mentioned my colleague Mikhail Tos in Havana. I did have a little sort of interview conversation with him that I transcribed. We did send it out in one of the emails, but we can make that available as well in case you would like to read that further. It's just a little bit more details, also just from the perspective of a German cultural mediator, cultural worker who has been working in Havana, and sort of his observations in the last couple of years, very intensely engaging with the Cuban cultural scene over there. So that might be of interest to you. We'll send that out along with the YouTube link once it's ready. And just as a reminder, the Vimeo link to the film is live until July 27th, thanks to the distributor. So you are still able to watch the film until then if you have not watched it yet. And I think that covers all of the sort of logistical things.
I just want to add one thing. If any of you guys might have another question about the film specifically, feel free to reach out to me. I appreciate that Rocco might be willing to answer a few questions as well on our social medias. Send a direct message on Instagram or Facebook, whatever. I'll be more than happy to reply as soon as I can, as long as it's not like a super lengthy, it doesn't involve a super lengthy reply. Thank you so much.
And we can also drop their social media, or at least Sebastian's. Rodrigo, it's up to you.
No,
but,
of
okay.
course, no.
Okay.
Feel free. It's at Roccocine, ROCCOCINE, and you can find me on both Facebook and Instagram. Also happy to answer any questions that you might have.
Great. So we can also drop their handles in the follow-up email so that everybody can see those on paper.
Wonderful website as well, which I discovered just recently, Rocco. So yeah, you can see what they're doing next, which I think is equally fascinating. So yeah. Thank you both so much. Thank you everybody for watching, and we'll sign off now, but I'm glad that there's a recording. We can send that to our friends, and hopefully lots more people will be calling up to try to get Un Traductor screened in many more places.
We hope so. Thank you for helping us spread the film.
Absolutely, anytime. It's timeless. All right, well, thanks everybody.
Vielen Dank.
Have a great evening.
Vielen Dank, gute Nacht, and auf Wiedersehen. Buenas noches.
Good night, everyone. Thanks for joining.
Good night. Tschüss.
Tschüss.